All right, keeping health first. Did you know heart disease is the leading cause of death for both men and women in this country? Well, CDC says heart disease is responsible for 1 in every 5 deaths. But there's hope on the horizon thanks to groundbreaking advances in structural heart care. So joining us today from Novant Health New Hanover Regional Medical Center is Dr. Lance Lewis, of course, to share a little bit more about this. So thank you for being here. We appreciate it.
Thank you so much for having me.
The first question, of course, and you've already mentioned that you do get this a lot, is what is structural heart disease? It sounds like we would know what it is, sort of the components, but you can explain it much better, I'm sure.
Well, yes. So typically with heart disease, people think of the heart arteries. They think of heart rhythms. So we talk about that in terms of how would I say, plumbers and electricians that take care of that, so to speak. So this is more like a carpenter. It's almost like the doors.
The building blocks.
Yeah, the building blocks. It's like the doors in between the heart chambers and the heart and the vessels that can sometimes become damaged or deteriorate, and we fix those, and typically those had been fixed with open heart surgery, and now we can do it through small incisions.
Oh, so that's definitely advanced for sure.
Absolutely. Absolutely. Helps with the recovery, much quicker recovery.
The heart is just such a big organ. You know, I mean, I know it's the biggest organ in our body, but it's such a big organ, and trying to understand the intricacies of how it works, how you can keep it healthy. So what are the causes of the structural heart disease?
So typically it has to do with either congenital heart disease, something you're born with.
That makes sense, yeah.
But much more frequently, it's a deterioration over time. It's like if you have a valve in your car. Over a number of years, that valve in the car may have buildup of debris on it, and it may function less well. So typically it is we call it a disease of birthdays.
Yeah, it's sort of overuse.
Yes, exactly.
kind of thing. So obviously you have older patients that you're dealing with.
Yes, typically.
Typically, so there's also some younger patients as well?
Yes, we also deal with the holes in the heart. So some people are born with holes in the heart, and they have associated issues with that. And the number one issue is we see young patients that have strokes.
Oh,
and it can be due to a hole in the heart, and we can close that heart now with a simple procedure that takes about 45 minutes. That is through the groin. That used to be only done in open heart surgery. So now they go home the same day. They don't have to spend days in the hospital.
That's great. So that are some of the advantages of having this advancement in that kind of treatment care.
Absolutely.
All right, great. Thank you, doctor, for joining us. I appreciate it.
Thank you so much for having me.